Hi, I'm Dr. Orlando Cedeno of Abacoa Podiatry and Leg Pain Center. If you've got a painful bump on your foot, a bone spur, a bunion, anything that rubs in your shoe and limits what you can do, there's a procedure that can take care of that. It's called an exostectomy. And what it really comes down to is shaving down the abnormal bone so the area sits flat again and stops causing you problems. I recommend an exostectomy when we've already tried the conservative route, wider shoes, those annoying pads, anti-inflammatory, sometimes PT, or an injection, and you're still in pain. The patients I take to the operating room, whether it's in my office or in the surgery center, for this generally fall into a few buckets. A painful bone spur that hurts with every step, bone that physically is blocking a joint from moving the way it should, skin that's breaking down from the bone rubbing inside the shoe. Calluses, blisters, sometimes even ulcers are formed, and this deformity can get worse and starts limiting your day-to-day activity. It's not right for everybody. I won't take somebody to the operating room if there's an active infection in the area, if circulation to the foot is poor, or if a systemic condition like uncontrolled diabetes or an autoimmune disorder makes healing too risky. And if the bump isn't hurting and isn't causing problems, we leave it alone. I don't operate on asymptomatic bumps. The procedure itself, very straightforward. Most of the time we do it under local anesthesia, with or without sedation, sometimes general depending on the location and the patient. I make a small incision that's very precise right over the prominence, carefully moving the soft tissue, tendons, and nerves out of the way, and then I shave the excess bone down with a bone saw or rasp until the contour is smooth. Once it's flat, I close everything back up with either one suture generally or steri strips. Most of these are under an hour start to finish. Recovery depends on where we operated and what we did, but the basics are the same. You'll be in a surgical shoe or a boot, or sometimes, but very rarely, a cast, whatever protects the site. For the first 48 to 72 hours, the RICE technique, rest, ice, compression, elevation, is imperative. That's how we keep the swelling down. Keep the dressings clean and dry until I tell you otherwise. Most patients are walking comfortably with a couple of weeks and back to their regular activity not long after that. The goal here is simple: get rid of the pain, get you back in your shoes, and get you back to doing what you want to do. If you've been dealing with a painful bump on your foot, come see us at Abacoa Podiatry and Leg Pain Center. We'll figure this out, and if this is the right procedure for you.